Good morning, Shirley.
Good morning.
Hi, Fern.
Hi, can you hear me?
Yep.
Okay.
Sorry about the confusion.
Everybody was mixed up this morning and nobody asked before you last night. So I reached out to Deborah this morning. I was like, was I confused? We didn't send out a notice. She said, I thought it was next Thursday. And then you said you thought it was this Thursday. Well, we didn't prepare anything, so it'll be next Thursday.
Whatever. It's okay. Give me time to eat something.
This is CB12 aging, yeah. Richard's going to be joining us. He just asked.
Okay. I'm not sure if Yosef is. He's on vacation.
Okay, but I see you have, looks like you have Glennis.
Yeah.
Do you have enough for official meeting or, well, we don't have anything to vote on anyway, do we?
Good morning, everyone.
And technically, these July meetings are not official. They're ad hoc meetings, you know?
Okay,
so,
perfect.
Yeah,
Yeah,
you guys are good. You guys don't need quorum, nothing. You just need to handle your affairs and report and, you know, update people on what you guys would like to today.
Okay, thank you.
You're very welcome. Makes it easier, right, Fern?
Much easier.
We need
Easier for me.
though, right, Paola?
I'm sorry, Mary, what was that?
We need official minutes though of the meeting.
No, yeah, you can transcribe your minutes, but as far, you know, as like members
I'm sorry,
being
hold
present.
on a second.
Mm-hmm. Sure.
Now, run that by me again.
No, I just wanted to make sure that you wasn't waiting on quorum. You know, that's my thing. You know, the attendance is not, you know, weight bearing right now.
Yeah, no, I got you. I mean, nobody's counted as absent.
Yeah, exactly.
Who was
But
present?
you even have a guest. One of the new board members has joined, Daniel Bonilla, you know, to see how your meeting goes and stuff like that. So.
Oh, that's right. He's one of the new people. Gotcha.
Yeah. So
Gotcha.
you know.
I wrote all their names down on my last.
Yeah, you're in good hands. You're gonna have a good meeting.
This is good. This is good.
Okay.
I'm waiting for. I have a speaker that's supposed to be.
Okay. Give him a couple of minutes. Give him a couple of minutes. It's literally only 5
Yeah, I know.
after.
It's not quite. Yeah.
All right.
You have, Biana is in the attendees, not as
Let
panel.
me swing her over.
All right. Let me see.
Her name is Biana, right?
Oh yeah, she is on. Okay.
Okay. I'll bring her right over.
Thank
Okay.
you.
There you go.
Good morning, Deanna.
Good morning. I was like a fish in a bowl. I didn't know how to cross over to you. I could hear you speak, but I was in the other.
Okay. I'm just give me a couple of minutes because Glennis, I have a favor to ask of you.
Yes.
Can you do the minutes?
Sure.
Thank you. I appreciate that.
This is being recorded, right?
Yeah.
Okay, perfect.
I'll take care of the attendance, but just, you know, the minutes, if you can do that, that would be great.
Will do. And good morning, everybody. I do have a slide deck that I prepared, so I just wanted to see if I'll be able to share a screen.
Yeah, you will.
Okay.
Catherine O'Sullivan, welcome. And Maggie, how are you?
Mary, you want me to bring over Catherine and Maggie as panelists, or they're fine where they are?
You might as well.
Okay.
Over, you know, so
I will.
Like we have 40 people on our committee, you know,
correct.
attending.
Right.
So.
Yeah. All right. I got you.
Hi, Catherine. Good morning, Maggie.
You guys are both muted now, but
yeah, So if you unmute yourself, you can say
You
hi.
unmute yourself, you can
Yeah.
talk.
And this is going to be a fun thing. Maggie, with ladies on vacation. So Maggie's actually setting up the big screen so that her clients at the center can join the meeting.
Very cool.
So, this is the kind of thing we want, that we're kind of pushing for. So this will be interesting, first.
I want to make it bigger. Let's make it big. Beautiful. Okay.
Cool.
Did you see the text from Catherine? Mary? She's saying she can't stay for the full meeting, but would like to know if this committee will advocate for the resumption of senior aquatics program at Hybrid Pool. And they used to be every
Absolutely.
summer.
They used to be. They used to have senior hours, right? Yeah.
Yeah,
Right.
I'm still here, and yeah, we really miss it. Our leader actually died of COVID, which was a real blow. But we'd love to have it back. And I did ask Steve Simon at the Parks Committee, but I don't know how much he's going to advocate for that.
Well, I know that there are issues in other pools. It's not only our
Okay,
pool.
hold on 1 second. Since this is getting to be an official discussion, let's call this meeting to order.
Oh,
At
okay.
10:36 a.m.
Yeah, I do have to
10:40,
run
I'm
as
sorry,
well.
10:40 a.m.
Let me turn that
Let's
off.
do some introductions first,
Okay.
and then I will take liberty of switching the agenda a little bit so we can discuss that issue first.
Oh, great, thank you.
So I'm Mary Anderson. Hi, Mariel. I'm Mary Anderson. I'm the chair of this aging committee, Community Board 12. Very much. Fern?
I'm Fern Hertzberg. I'm the executive director of ARC 16 Fort Washington, and also the co-chair of the Washington Heights Inwood Council on Aging.
Richard, welcome. You introduce yourself. Richard?
Not yet connected to audio.
Not yet. Connecting, I think. Yeah.
Are you hearing us, Richard?
Yeah.
You introduce
Yes.
yourself. We're doing introductions.
I believe I'm unmuted. I'm Richard Allman.
You're not muted. We can hear you.
I'll do
Very
that
good.
again.
Thank
I'm
you.
Richard
Okay.
Allman. I'm here both as a member of CB12, member of the Aging Committee, and I also work running one of the senior centers that are part of ARC Fort Washington, which I suspect Fern has introduced already.
Hi.
Daniel, please introduce yourself. You're muted. so
No.
There you go.
Hi, my name is Daniel. I'm part of the CB12. I just got appointed. I'm an artist in Washington Heights, Inwood area. And I'm just here to be a fly on the wall and just see how this whole meeting happens and all that stuff, since I have some time today.
Fantastic. We welcome you. And, if you're not able to join this particular committee, we hope that you will recommend it to others of the new people. Now, who's on the phone here? 212?
Me, Carol.
Oh, okay. Okay. Hi, Carol. How are you?
Hi. I'm alive. That's what I'm saying.
Good. Introduce yourself, please.
I'm Carol Weeks, Dykeman Senior Center Director, Program Director.
And public member on the Aging Committee.
Exactly.
Okay.
That's the important part.
Right.
Will this presentation only be in English or will it be translated as well? Will this be in English and Spanish, you're asking?
Mary,
Yeah.
Maggie is asking if we'll translate into Spanish, and I can certainly take a
Oh,
stab
yeah.
at it, and then you can help me, Maggie, to the degree that it's needed, okay?
Perfect. Maggie, introduce yourself, please.
My name is Madison Hernandez, and I'm the Program Data Manager for Star Senior Center. Sorry, my
Okay.
camera's down here. Camera.
Good morning.
Good morning, Lilia.
How are you, Mary?
I'm okay. Shuli, you want to introduce yourself?
Good morning. I'm Shuli Gottman. I'm the director of Mariah Senior Center, and I'm also on the executive board of WICOA.
Biana.
Good morning, everybody. My name is Biana Roik. I'm a guest today for this committee. I am a senior associate dean for clinical affairs at Columbia University College of Dental Medicine, newly arrived last year, transferred from California. Nice to be here.
She is our presenter today. Catherine, you can introduce yourself if you're still here. You need to unmute.
I don't see her. Even though she's
her picture is on, but
yeah.
Marielle.
Good morning, everyone. My name is, sorry, I have allergies. My name is Marielle de la Cruz. I am the Upper Manhattan representative for New York City Controller Scott Stringer. And I could just say, soy Marielle de parte de la oficina del Contralor Scott Stringer. Soy la representante de la comunidad. Thank y'all for having me.
Gracias. Lilia, can you introduce yourself, please?
Good morning, everyone. Liliet Lopez. I'm an outreach specialist for Night Connect. We connect people with any disability, any age, to resources, services, or it can base on people's needs. I'll put my information on the chat. Thank you.
Liliet, would you repeat that in Spanish, please?
I'm sorry. Mi nombre es Liliet López. Soy la Outreach Specialist de Night Connects, un programa para las personas con cualquier discapacidad, cualquier edad. Lo conectamos a recursos, beneficios o puede ser basado en la necesidad de la persona.
Muchas gracias, Lilia.
Okay, so I'm going to take the opportunity.
You're missing two people. Glennis didn't introduce herself, and
I'm sorry. Glennis, I'm sorry.
No worries. Good morning, everyone. My name is Glennis Aquino Gill. I'm part of the Aging Committee. Buenos días, todo el mundo. Soy Glennis Aquino Gil y soy parte del Aging Committee para CB12. Gracias.
Marie, welcome aboard.
Good morning. It was a little bit difficult for me to get in, but I'm here.
Okay, so just introduce yourself.
Marie Garson, nurse practitioner of House Call program from Columbia Doctors. Thank you for inviting me.
Thank you for coming. Okay. All right, so
hang on one second.
Sorry. Okay, so I am going to take liberty to change the agenda because Catherine has to go to work. Catherine, are you on still?
Yes, I am.
Okay, great. So if you could just say what you said before, and we'll also have to translate it. Okay, so
okay, sure.
A new agenda item. Okay, about the Hybrid Park.
Cool.
Really.
Okay, let me see. Okay, so I'm a member of the Senior Aquatics group. We met for 8 weeks every summer. it was really a highlight of life in Inwood for me, and I'm not sure for others. We came from, most of us came from Washington Heights or Inwood. There were sometimes groups who would bus in from the Bronx. It was a very fluctuating group, but I think we probably had about 15 to 20 core members. And we really missed it last year. And it was really unfortunate that our sort of leader, if you like, the woman who brought the sound system and did the emailing, died of COVID. She was one of the very early victims, and we all miss her terribly. She was extremely vivacious and a very wonderful person. So, with COVID retreating, supposedly, I'm really eager that the senior splash returns to Highbridge. It's a really valuable program. I'm amazed that not more people make use of it. It will provide jobs because there will be some lifeguards, and there will need to be our great aquatics teacher, Jose Bracho. So, you know, it would be really great if all the money coming to Upper Manhattan that I just read about this morning, the millions and millions coming to Upper Manhattan, that a little part of that could be provided and make a lot of people very, very happy and fit and healthy. So that's my spiel, and I hope that this committee will sort of back up and maybe, I don't know, write to Jennifer. She'll say pools aren't her thing. Write to talk to Steve, ask him to push for it. I don't know who we need to talk to kind of make this happen. That's
In
my.
the past, on this committee, we actually have had.
Hang on, Mary. Let me translate at least some of
Oh,
that.
sorry. Okay.
Yes.
Catherine está hablando de la piscina de Highbridge, del parque. Ella representante un grupo de personas mayores quienes están usando esa piscina por más de 8 años. Cuando empezó nuestro programa de transportación allá. Y ella está preguntando si eso va a abrir otra vez ese verano, porque hasta ahora no está abierto por las personas mayores. Okay, I translated the gist of it.
In the past, we actually have had a representative from Highbridge attending our meetings. This is a while back. And I tried to get that reinstated, but they didn't have, you know, the ability or the person to be able to come to the meetings. But, you know, they always talked about what was happening for seniors at Highbridge, and particularly the program, you know, the aquatic program, and had, you know, an hour put aside certain days a week for seniors to make, you know, to use the pool, which was really, really nice. Does anybody else have any input into or?
So I can.
About this?
I have a comment.
Okay.
I know that the seniors here in Harlem told me that there are also issues with the senior program at the Jackie Robinson pool. And so I think it may be a broader issue than just Highbridge Park. And I suggest that using CB12 behind us, that perhaps, Mary, you could reach out more strongly to Steve. Estoy diciendo que tengo el mismo información del parque y piscina de Jackie Robinson en Harlem, y creo que ese problema es posible, está más grande en los parques. Estoy preguntando a Mary para representar a nosotros y hablar directamente a Steve de esa situación en los piscinas y parques.
I think that probably well, I don't know, because I don't think that the Health and Environment Committee is meeting, but perhaps we can do something.
I would really
a
appreciate
letter at least.
it for
Yeah, yeah.
And I have to be rude now and dash off now that I've said my piece, but I really
understand
the time.
But thank you for coming and bringing this issue up because it's an important one.
Sure.
Definitely.
Have a good day, everybody.
Okay. Joseph, hi.
Hi, I'm here. I can start taking notes now.
Okay, Glennis, you're off duty.
Wait.
Sounds good.
Okay, just, send what you have to Joseph and he'll incorporate it into what he's writing, okay?
Okay, sounds good.
Thank you. All right, so with that, let's move to our presentation by Biana. How do you pronounce your last name? I'm sorry.
Roik.
Who, as
Biana, are you bilingual by any chance?
Sorry?
Bilingual, but Russian. I did work in San Francisco in the Mission District for about 4 years, so I have a pretty reasonable dental Spanish because we treated predominantly Hispanic American population there. So I couldn't.
Okay, I'm not sure that I have a dental Spanish, so let's see what we can do between us.
Thank you. I'll try to pause here and there to give you time to translate.
Mm-hmm.
Okay, so you're on.
Okay, fantastic. Good morning, everybody. Can everybody see my screen?
Yes.
Maggie, can your group see the screen okay? Maggie?
Yes, I think we see a thumbs up. Okay, fantastic.
Thumbs up, yeah.
Okay, so esa presentación está de acceso de dentistas por pacientes de quienes están en casa. Diana Roico está en carga de ese programa. Diana, por favor.
Gracias. Good morning, everybody. Thank you to Mary and the committee for extending the invitation, and special thanks to Marie Garçon, who connected us. Today, I'm here to speak with you a little bit about a pilot program that we started during the COVID year of 2020 in collaboration with the School of Nursing at Columbia University in order to improve our access to at least urgent assessments for homebound patients in our local region. So today I'd like to review a little bit about this pilot, discuss some of the ways we've been leveraging telehealth technology, talk a little bit about our progress and some of the challenges that we have encountered and what we learned, and talk a little bit about next steps.
Oh, wait, stop. Maggie, would you do me a favor and translate that? That's way outside my skill set.
No rush. Not rushing.
Did Maggie translate for us?
Thank you. So I'm recently moved from California, as I mentioned, and just over the past year, learning a little more about our special population that we are taking care of at Columbia. The target population for the pilot are homebound patients who reside in Washington Heights and in the neighborhoods of Northern Manhattan. As many of you know, this is an underserved, ethnic minority urban community. About 75% of the population is Hispanic Americans, and 13% of this population are people over 65. The care for the underserved is often fragmented. These are homebound patients, and it's hard to deliver services. And so, a special coordination is required to help overcome some of these access challenges. The population experiences high rates of chronic illnesses and frailty and other comorbid conditions. There's definitely preponderance of these conditions, and we see.
Okay, Biana, I'm going to stop you. I appreciate this, but that's not what the people who are listening to this on a big screen understand. This is a really complex set of data. So I'm going to try to say it in English first, shorter,
okay,
and then say it in Spanish. Is that okay with you?
Yeah, absolutely.
Okay. No problem. I'm familiar with this because I do a lot of research. I know this data, and I know that this isn't the way people understand it. So most of us in Washington Heights are Latinos, more than 70%. 13% of us are seniors. Actually, it's more like 16% if you count the people over the age of 60. Many of us have diabetes, hypertension, and are obese and have high cholesterol, which are comorbidities, which is what they mean by comorbidities. They're chronic diseases that affect our health generally. And the rate at which we have these illnesses is higher in the Latino and the African American communities. And many of us do not have coordinated health care of any kind. En español. La mayoría de nosotros, y estamos más de 200,000 personas en Washington Heights y Inwood, son latinos. Más de 70%. Y también 13% personas con más de 65 años. Pero tenemos más de 16% quien están más de 60 años. Muchos de nosotros tenemos diabetes, presión, colesterol, y tenemos más pesos de necesitamos. También esos son comorbidities y esas situaciones tienen impacto de nuestra salud en general. Y está más por ciento de personas quien están latinos y personas de colores, por ejemplo, I don't even know how you say blacks in Spanish. Negros, maybe. Y muchos de nosotros no tenemos cuidado de salud que está coordinado, especialmente cuidado de dientes. Okay, Viana. Sorry.
Thank you so much. Thank you very much for that. And just to highlight that for homebound seniors, these experiences are even worsened and even more complex.
Well, certainly the dental care is. So, personas quien están viviendo en casa y no pueden salir tienen esos problemas y más.
Columbia University has a commitment to what we call the empowerment zone as part of the development of the Manhattanville campus. The university made commitment to the community to help provide various services to these 17 key districts. So this is where we focus a lot of our attention when we think about dental services at the College of Dental Medicine.
El programa de colegio dental tiene foco en esa parte de la comunidad.
What we learned is that comprehensive care, good care for patients, diagnosis of new problems, management of diabetes and high blood pressure, high cholesterol, that this is a very critical, important component of preventing further downstream complications.
Dental complications?
Including dental complications, medical complications, and dental complications.
Okay. Cuidado de personas quienes están solamente en casa. Cuidado, diagnosis y manejar de condiciones crónicas, similar de diabetes y presión, están parte de proveer, I guess, cuidado de salud. Y conocemos si está en coordinación y en total, eso es mejor por esas condiciones.
We know that nurse practitioners are an incredible workforce of healthcare providers who are embedded in these communities, who go and visit patients' homes in case they are homebound. And we felt that this would be an ideally suited population of practitioners who could help to deliver not just primary care services, but also primary care dental screenings.
El Colegio Dental está trabajando con los nurse practitioners. Eso es, ¿cómo se dice nurse? Somebody.
Enfermera.
Enfermera. Thank you.
Yeah.
Las enfermeras quienes tienen una licencia para practicar directamente en la comunidad. Y ellos están trabajando con ese grupo y Marie Garzón, quien está en esa conversación, está en carga de ese grupo.
There was a demonstration project, the latest data from 2013, that showed that there's a huge aggregate of savings per person, and also a major reduction of rehospitalizations for patients who receive well-coordinated care in their homes through nurse practitioners.
And where was that demonstration project done, Diana?
This is an ongoing project, but the latest data is from 2012, 2013. So it was in that prior decade.
Is it national? Is it local?
Yes, no, national.
Or is it's national?
Yeah.
Okay. I on grupo que están chequeando en un programa similar de eso. Y ellos están diciendo que está un programa que da más salud a los miembros, menos visitas a cuarto de emergencia y menos volver al hospital. Y también el gobierno va a, ¿cómo se dice? Save somebody. Pagando menos dinero en salud de esas personas.
Using this information here at Columbia, we were trying to think about what new technologies we could leverage to help bring oral health assessments to the patient's homes. And we settled on telehealth.
Ellos están usando telehealth. Eso es servicios en casa con computadores o en teléfono para proveer cuidado de dientes.
A nationally representative survey, this is a national survey, looked at the role of telehealth over this last year. And it found that the majority of Americans experienced a telehealth visit with a medical provider in 2021.
Estaba un estudio nacional y ese estudio dice que la mayoría de americanos tenía una visita con su doctora o doctore en 2021 de teléfono o computador.
However, most respondents who were surveyed did not have a teledental visit.
La mayoría no estaban visitando con una dentista.
A new survey on the state of oral health equity in America, this is a 2021 survey, found that 2% of the persons who responded to the survey received dental care remotely.
You may as well read the whole thing. It's a bunch of stuff that's not relevant to this community because the majority don't have computers.
Yes, so 2% received dental care remotely. 63% did not know that their dentist offered remote telehealth service, and were unaware. Some were just completely unaware. However, those respondents who did have a teledental visit enjoyed the visit, and they said that they were very likely to see their dental provider again if they had an opportunity. And those who did have a teledental visit felt that the visit was very similar to an in-person visit. And those who did not have a teledental visit felt that if they had a chance to have one, they would.
Okay. Muy simple. La mayoría de personas en ese estudio no conocen si hay servicios de computadora o de teléfono con una dentista. 63% no conocen. 2% reciben servicios en esa manera. Y 33 personas conocen si su dentista no está trabajando en esa manera. De los 2%, can you put that back, please? Del 2% quien reciben servicios, ellos les gustan. Y ellos dicen que 36% dicen ellos va a tener ese servicio si hay una oportunidad. 35% de total dicen ellos no lo tienen, pero va a tener interés de tratarlo. De try. Try is not tratar. What is try?
Tratar.
Tratar. Thank you. You can tell how long it is since I've actually tried to do something this complex in Spanish. Okay, go ahead, Diana.
Thank you so much for helping out. At the College of Dental Medicine, we have used telehealth during the height of the pandemic. We followed all the state regulatory recommendations coming from New York State, Department of Health, American Dental Association, and various other ones to try to be available to our patients in the community during the time when suddenly all of care had to pause. We developed special algorithm in our electronic medical record to better guide the clinician as to how urgent the problem was and whether the patient should be seen in the emergency room, or if we could treat the patient while they're at home through the use of medicines.
El Colegio de Dentistas tratar entre marzo a julio de 2020, durante la pandemia, para tratar a hablar y tratar pacientes Y ellos tienen una oportunidad de tener una plataforma similar de esa conversación para usar en las casas de pacientes y ellos estaban hablando y consultando con los pacientes hasta julio, hasta ese momento.
During this time, we learned a lot about how to help patients through telehealth communication when it comes to helping them with some urgent or emergent dental needs. We redefined our protocols and tried to train our providers to understand a little bit better how we can use telehealth to support patients. You can see in the picture on the right that initially this is how we worked with those patients who could connect with us. They used whatever technology was available, Zoom, cell phones, taking a picture and sending an email to help show the providers what the concern was.
Las pinturas están diciendo una idea de los tipos de tecnológicos servicios quien está trabajando con los dentistas. Eso es de pinturas, de email y otras oportunidades para comunicar entre los dentistas del colegio y los pacientes de ese.
In thinking about the homebound elderly and reaching out to them, we felt that with the nurse practitioner on site with the patient by their bed in their home, we could perhaps enhance the teledental experience by using additional technology such as a special intraoral camera.
Go ahead, Glennis, give it a shot.
Can I interrupt for a quick comment? So one of the participants is saying that this technology seems a little bit too advanced for them to use at home. They don't think that it's really accessible.
Yes, we recognize that this technology is complex and there are a lot of limitations. People have to have the technology, they have to have reliable internet access. And we learned that this was a lot of the barriers that we face when trying to support the community in this remote way. And that's why we felt that the nurse practitioner being the conduit, having the nurse practitioner inside the patient's home, having the nurse practitioner armed with the technology that a nurse practitioner would use, armed with the correct laptop and hotspot in case the patients didn't have the fast enough internet connection. Having that nurse practitioner right there next to the patient was truly going to help us to break through some of this traditional barriers that we observed during the height of the pandemic.
But isn't that taking an already small population and making it smaller?
I think it's...
So let me say it a different way. I run a senior center at 174th Street and Broadway. 90% of our seniors don't have connectivity at all. They have cell phones and that's it. And their cell phones, many of them are SafeLink phones with very limited minutes. And they're not seeing a nurse practitioner now. How would they be able to be part of this project?
Well, this demonstration project was focused on specifically patients who are homebound. And I think that a patient who is not homebound, although they may have other challenges, should have more opportunities to physically show up and see a dentist in a clinic. For example, in the teaching environment, we accept Medicaid and a lot of reduced care is provided to this population.
You mean reduced pay?
With reduced pay, exactly. A lot of reduced pay. We accept many different types of Medicaid, and those patients who are underinsured or uninsured can really benefit from significantly lower fees that we provide in the teaching environment at the college. And so, but I think that the challenge with the homebound population, as we discussed earlier, is that this population is really difficult to transport. These are not necessarily bed-bound patients. There's a difference, but nonetheless, would require a lot more coordination to be able to get them to additional services or additional providers. And so the idea was to leverage the nurse practitioner's skill and the fact that they're on site with the patient and enhance the teledental experience by giving the nurse practitioner more precise technology so that we could evaluate the patients a little bit better than just looking at a screen of a computer.
Maggie, I need you to help me out with a translation of what we're saying because I have comments myself and I get confused.
I was translating as she was going along, so we're good.
Okay, so we have 28,000 seniors in this community. The vast majority of them have limited access to dentistry. Most of them don't have spare money to spend on dentistry, and they don't see that as being their first priority. And the homebound patients, have you worked with, oh my gosh, my mind is shot now. But one of the dentists at the dental school did a lot of studies with homebound seniors. Are you aware of that?
Dr. Albert, David Albert?
No, a female.
Dr. Edelstein?
No, I'll get you the information and connect you with her. But she's done a whole lot of work with homebound seniors pre-pandemic when she was able to go to the house and see them and meet with them and see what their problems were, which went beyond dentistry to not being able to eat, for example, the food that came with Meals on Wheels. So the problems are myriad. And I'm trying to get some sense of how many people you're actually serving this way.
I think that the catchment area is any patient that the School of Nursing nurse practitioner was visiting at home. I believe Marie is on the call with us. She's the primary nurse practitioner involved in this pilot. She's sees about 200 patients. That's generally her pool of patients that she manages. Some have access to dental care, some don't. And it's really, the pilot was really to help out and reach out to the patients who had urgent needs and perhaps didn't have an easier way to connect with a dental provider.
Just to add on, the catchment area was Inwood, Washington Heights, and some of the Morningside.
So it wasn't that big area that was on the map.
It wasn't the full area that was on the map. The full area on the map is sort of our commitment at Columbia to what we consider local and the population that we'd like to be able to target through any and all programming that we do here at Columbia when we reach out into the community. So that's what Columbia considers local in our endeavors to do any kind of, whether it be dental or medical or anything else related to healthcare.
So that was the catchment area that we reached out to for the vaccines.
Correct.
And,
okay.
And of course, the nurse practitioner house call program, and our intention is to expand our services to more those areas that Dr. Biana has on the map. We will expand our services.
Okay.
So just to share it, and then so again, this was a pilot, so small sample, but the concept was to bring oral health back to health, not to delineate oral health against health. Oral health is health, and that's the concept with which we're approaching it. And like you said, there's a huge gap in trying to get dental services to this patient population. So the idea was to train nurse practitioners to help us perform some basic intraoral assessments using this technology. And the fallback is that there was a licensed dentist on the other end, helping to see into the patient's mouth with the help of the technology that the nurse had in her hands. So the focus was to identify any urgent dental needs, prevention, any kind of home care discussions. Some of the patients have perhaps newly fabricated partial dentures or false teeth in the mouth, and they may have just received them right before the pandemic started and did not have a chance to have any follow-up care, and maybe have been suffering with sore spots and difficulty eating and chewing. And so a lot of it focused on appropriate care for these appliances, even speaking with some home aid personnel, and on some of these calls, we even had family members of the patient with us, participating in the teledental visit, trying to understand the needs and being as responsive as we can to them through the collaboration.
For who? For Ida?
I think Maggie is translating the
The wonderful thing is that all of Colombia is now on a shared medical record epic. So whatever our nurses see, our dentists see, and that collaboration makes care coordination and understanding the patient's course of care a little bit simpler. But just to provide an example, the use of intraoral camera, this one is called Mouthwatch, placing the camera into the patient's mouth, you can see here, helps to augment the photograph. You can see on the screen much more than you can just see when the patient smiles at the computer or using their telephone, if they have one that's capable of doing it. And therefore, the dentist on the other line is able to better understand how urgent or critical potentially something is. And we can only achieve that by having a medical provider bedside with the patient. This was a big collaboration between nurse practitioners, dental faculty, dental students, nurse practitioner students, social worker who helped to coordinate a lot of the care, social worker interns, and the goal was to also incorporate physical therapy students, and I will share why in just a moment. Some of the challenges that we faced is that when the care had to become interventional, when we stopped with prevention, we talked about prevention, we talked about maybe prescribing a medication for a dry mouth or something that we could manage remotely, that was fine. But when we had to potentially see a patient for a critical need, we needed to figure out how we were going to get this patient to the much needed services. And one of the next stages that we are considering is the use of a mobile dental van. These patients are homebound, but they're not necessarily bedbound. They have challenges with mobility, but they're not immobile. And if we could bring the correct technology as close as we can to where the seniors live or where the patients reside, with the help of, let's say, physical therapy or transport team, bring the patient onto the mobile van without having to have them travel too far, we feel that we can successfully provide some basic interventional care to keep this patient population out of deeper trouble or potentially ending up with major infection in the emergency room. We understand that there are concerns. As you know, Medicare does not provide coverage, critical coverage for this important service. 1 in 5 Americans over the age of 65 have untreated tooth decay. This is the latest study from Harvard Medical School. And very fortunately, just recently, in the last couple of weeks, U.S. Senate Majority Leader Chuck Schumer wrote a new bill proposing to add dental, hearing, and vision to Medicare. And I think that brings a lot of promise because, any goodwill that we provide right now, this pilot is largely focused on, unreimbursed care. We were trying to be responsive to this small population, as you've noted. But to scale it and make it, more available, it would require a focus on sustainability and partnering with a federal payer. So I'm very hopeful that this new bill will have traction and move forward. We've looked for grant opportunities and some strategic partnerships to help us bridge until we get to a point where we can fund, to help us bridge the use of technology, the van, and ongoing teledental visits with these patients until we get to a more stable time. The final summary is that this is a hopeful way to connect. It doesn't solve all the problems, but when you are out of options and you have a chance to be reassured, to be assessed, to be heard, to have somebody advocate for you and provide a path to receiving vital care, I think it's much better than nothing. And I'm very grateful to the team that launched this endeavor. And not only did we launch this endeavor, but it's also being ingrained into the young, impressionable minds of nursing students, dentistry students, and other students in thinking about service learning and our responsibility to this community, even beyond when they leave the four walls of the teaching institution. I thank you so much for your time. I'm sorry I didn't, when I was invited, I wasn't sure who the audience will be and exactly who everybody will be in the audience. But I'm delighted to be here. And if you have any questions, I'm happy to think about them with you and learn from you.
So we have
Thank you for your presentation. Go ahead, Maggie.
Sorry. So our seniors have some comments.
Okay, just Bianna, if you could unshare your screen now.
Absolutely.
Thank you. Okay.
So they want to say that they love the idea of the van. The van is exciting. And you heard that?
We're very excited about the van. Right now, we're working with a larger collaborative with New York Presbyterian Hospital, Ambulatory Care Network, Columbia University, and the College of Dental Medicine. There are some different pools of monies coming from various organizations, Mother Cabrini, March of Dimes, NYP Hospital itself, in hopes to launch various type of mobile units to provide different kinds of services. We're doing different needs assessments to understand what services would be the most effective, which services are synergistic. We don't want to have 10 different vans sitting out there rusting. We want to figure out how can we maximize the kind of vans that we build to provide coordinated services. For example, could HIV care be paired with oral health? Do these go together because of various inflammatory things that we need to manage? Can vision and dental be together? Is that a service synergistic that could work together, leveraging one van? So there is a lot of focus on the use of mobile units and how they can help us to overcome some of these challenges that we've always known we had, and the pandemic brought to light even more. So
I have a question.
All right, go ahead, Vern.
Do you have all the material on Elder Smile and its 10-year history with the community?
I'm stepping into the role relatively new. What I will tell you about Elder Smile is that the program there is material. I think that it's been launched, it's been happening. In my early cursory review, I don't think it's been as successful as it needs to be. At this point in time, we are working with leaders of Grantville houses and Manhattanville houses to try to schedule visits to the sites. I'd like to see the sites and understand a little bit better from community managers about how we can do better service to this community. We're working with other partners such as Arch Care to understand, our capacity, reach, and how we can redesign whatever Elder Smile original intent was to make sure that we are bringing these services in a coordinated manner. I think the issue continues to be sustainability, and these programs that are just not reimbursed have to be supported or offset by other activities. It is very challenging to maintain staff, the vehicles, the support team without having a revenue source, especially because a lot of the care is either unreimbursed or under-reimbursed. So I think, to be honest with you, at this point in time, the focus of this current year is rethinking Smile Care. I'm learning a lot about what our
Elder Smile.
Elder Smile.
It was really focused. So there was a dental van. It was used Monday to Friday during the school year for kids. And they essentially said, since we're using it for kids during the school year and it's not really used in the summer, why don't we launch a program to use it in the summers?
I heard that, and it just doesn't make a whole lot of sense to me.
Well, it didn't make a whole lot of sense to me. However, I was one of the point people on that project. And you take what you can get, because dental care is hard to get, especially for people who have no resources to pay for it. So it was mostly on-site exams of client screenings, discussions, and then they would bring the dental van to actually do an exam by appointment. The clients would make appointments for it. So my opinion, and I'm very clear about my opinion, is that our seniors need dental care. The majority of our seniors need dental care. And anything that we can do to support that, we want to. We did write a letter of support regarding having Medicare be part of, pay for dental care. We know that that's a barrier. So we're in this on an advocacy way with the dental school. But I think you're going to get a whole lot of more intense questions, because we want you to come and present to WICOA, which is the Washington Heights Inwood Council on Aging. And I think having a more defined idea of how we can work together would help us.
Thank you. I think that's very helpful. We have new leadership right now at the College of Dental Medicine.
Oh, yes, I know.
As a result, this is a discovery phase. I can tell you that in our early, reach out to the, at least the Grantville houses and Manhattanville houses, we learned that there's actually little kids camping out in the senior centers. So we couldn't really do anything this summer. The kids took over the whole year. But we've begun our process, and we certainly will be reaching out, Fern, to this group and to you for some historical, guidance about what worked, what didn't work, because that's always important to have as we start to reimagine and rebuild the next.
Okay, I just want to ask the other committee members if any of you have questions or comments.
Looks like Lily.
Daniel, as a board member, do you have any questions or comments?
Not at the moment. I'm just listening to this. I think it sounds like a good idea, and especially like the mobile, having a dentist truck come to the neighborhood to assist people that can't get out their house and stuff like that.
Okay, thank you.
We'll have to work with the city. We'll have to work with the city to help us find parking spots and figuring out where to safely secure the van as close as possible to where patients live. These are some of the challenges that we have to think about when we deploy mobile services as well.
Lilia, you have your hand raised. Go ahead.
Thank you. So my question is this is only for seniors, or you guys are willing to see any age or any disability?
Well, the presentation today was really focused on just sharing a little bit about the pilot for homebound patients. A lot of them happen to be elderly seniors, but not all. So it really was targeting specifically homebound. But the services that the College of Dental Medicine provides is focused on Head Starts. We provide care for about 70 Head Starts in that community. That's, where you saw the zip codes, what is local. We're really focused on about 6 out of the 17 zip codes that I shared, and those 70 Head Starts are in about 6 of those zip codes. So we provide routine services for kids in the Head Starts, and then the other spectrum was the Elder Smile program.
Okay.
And everybody in between, we do offer services to parents and siblings of some of the children, for example, that you might see through some of the participating programs.
Okay. The reason why I was asking is because we do serve any disability, any age, as I stated, and among those are homebound. So I am interested in getting connected with you. I put in my information. I don't know if you are, can you guys see it?
Deanna, maybe you can put your information in the chat.
Sure.
It doesn't allow me to type it in the chat. I send it in the questions and answers.
Ah, okay. On the Q&A. Okay.
I just have to add on the disability. A patient that are in our population, I have some that are young and they are disabled. Yes, they will be part of that program. They were on the pilot program and they will be continuing to be in the van if they have to be, whatever we have to do. We will take disabled patients. Yes.
All right. Thank you very much for this presentation and the questions and answers. Does anyone else have any question or comment? Going once, going twice.
Comment.
Okay.
Probably Biana has, if you can add on whatever we can get, the support we can get to have this mobile van going to serve the population, where we'll be, any idea, any connection, network, we'll be willing to work with any organization, anybody who has any idea where to get the funding, we'll be willing to get in touch with you.
Okay.
Thank you so much. That means a lot, and we will be leaning in on and taking you up on that offer. So thank you.
Thank you. Ilana, welcome. I think she's trying to get in. All right, let me move on. To G on the agenda. How are the senior centers doing and what are they doing? I'd like to, hear some updates from various directors, and because people ask me, and they have some information too. I get feedback from some of the people that attend the centers, but let's share. Who wants to start? Julie, you want to start?
You hear me? Okay, I just thought Fern might want to start. We started in June with Grab and Go. That was very successful.
Just if you can just repeat what center you're with, Shirley.
Oh, sure. Mariah Senior Center. Following DIFTA guidelines, we started with Grab and Go on June 1, I believe, or June 6. I don't remember anymore. That was very successful. We did well with that. Seniors came back. They were excited. Then we heard in mid-June that we could open for socially distant, masked indoor activities as well, including congregate lunch. We sent out a survey which seemed to indicate that about 50% of our clients were interested in continuing with grab and go, and 50% of our clients were interested in eating on site. So we decided to start on July 1 with a hybrid of on-site lunches and grab and go. We thought we could handle both because only 50% wanted to eat inside. In reality, it's turning out to be a challenge to get them to come inside. I don't know why so many answered that they would, and I think they're enjoying the convenience and the flexibility of grab and go, but it's a little bit of a challenge. Yesterday was a bit better. Yesterday was about 50-50, but last Friday, I had 100 meals. I had 12 people sitting down. All the other meals were sold out. They picked them up. They like to be able to take them out. Possibly some of my Sabbath observant clients were happy to get a Shabbos meal home and they could eat it on the weekend. But, I want to get back to more on-site activities and better attendance with that. And unless we can get them in, that's going to be a challenge. They're getting bored of the Zoom activities. We did have Zoom activities. We still do. We're doing a hybrid, but Zoom exercise isn't cutting it for them. If it's a really interesting program, they'll join via Zoom. I'm open to any suggestions on how to get people to come back inside. I don't think it's a fear I think it's just a convenience. Sending a friend to pick up, sending a home attendant to pick up. We want to encourage people to get back out in the world. That's where we're standing right now.
Okay.
Alana has her hand raised.
Okay, Alana, go ahead. Alana? Alana, we're not hearing you. All right, we'll come back. Maggie, do you want to update us on STAR and how you're doing?
So I'm crouching down on the floor. Hi. So the center reopened for grab and go on June 1st. And we immediately had a good response. I would say about 40 people per day coming in for food. Some taking 2 meals because we had enough. We had 60, we're approved for 65 meals. And then on June 14th, we opened and we started with a full programming of classes. So we have live classes here. We're doing grab and go, and we're also doing sit down meals. So Congregate Meals. We have about 40 people that come daily for Congregate Meals. And we have a large space and we're very spread out. So I think they feel comfortable because of the space. The space is very big. We only have, I think, 12 tables out. And we're very strict about how many people can sit at a table. We walk around, we make sure everybody's wearing masks. But I think the space makes them feel safer because it's so big and open. Grab and go, we're getting around 30 people for grab and go. Actually, it's a little bit less, I'm sorry. I would say 22 people for grab and go and about 35 that stay in to eat. Some come in for classes and leave, but we have to constantly monitor the numbers because we can't go over 50, including staff. So, but it's been a good, smooth transition back into being live at the center. Seniors are happy, we're happy. We painted our space also. Between volunteers, between interns and staff, we repainted the whole center. And we also have new murals, which we painted as well. So it's been very positive. And that's it, that's the report.
Thank you, Maggie.
I'll tell you about ARC.
Okay.
Okay, ma'am?
Yep.
We did not elect to opt for grab and go, and we only began serving meals this week on Tuesday. We started out with 30 on-site congregate lunches. But that day, in the course of the day, we had over 50 people come in for casework, for activities, and for lunch. And each day we're having an increase. So it's not a huge increase, but it feels like the word is getting out that we're open. We also have the tables spread out, and the number of people per table quite limited. Our tables normally seat 8, and they are right now seating 3. So we have probably a capacity in our room of about 70. And we are getting 20 people who are coming in the later part of the afternoon for bingo. So one of the things was bringing in bingo, because that was like a demand. We're also opening our 2 sites in Harlem, and both of them also opened on July 6th for meals. We are having the same experience at A. Philip Randolph. We started out with about 30 for lunch, a lot less for breakfast, about 11. And each day we have an increase. People are utilizing the entire space. We have a lot of rooms, so they're going to the various rooms to be on the computer, to be in a card room, to be in the art studio, etc. And our least utilized program at this moment is Central Harlem, where we also have about 12 we had 18 for breakfast and 18 for lunch on the first day. And again, that too is showing a slight increase each day. But they are not participating in activities at all, and are having their meals and seeing the caseworkers and leaving. So we're experiencing some of that as well, Shuli.
All right, thank you.
I
Ilana.
think you're right about the activities, by the way.
Sorry.
I'm sorry, I didn't mean to cut anybody off, but we did
That's
have
okay.
one day on the 6th. We are changing to a new program assistant, and we had a meet the new program assistant and her therapy dog day. For that, I had a lot of people attend, but I don't think it's the physical distance, because we also have a big space like Star. I think it's just encouraging them to come back. Some of them have gotten sedentary. Richard has his finger up.
Yeah, I just wanted to add just a little bit to Fern's report on the A. Philip Randolph Center. We're hearing some from seniors. We have restrictions on what's appropriate on strenuous levels of exercise, exertion, etc. And while this meeting has been going on, an exercise class just went up from 1 last week to 7 this week, that people expressed a lot of interest in yesterday. It was done in a moderated way, but there's a lot of interest out there just in how people can use their bodies and feel it some.
But I will say that we did not allow to start with strenuous exercise of any kind. Instead, we had our normal exercise instructors doing stretching, strengthening as our starter. And that's what appealed to people, because they felt that anything more strenuous was too hard right now.
I think also the heat might have affected this week. A lot of my seniors are telling me they didn't want to come out in the heat, and that's why they were doing grab and go. They were sending someone else. So maybe that's a factor too. It's really hard to judge.
It could be.
Yeah, not just didn't want to come out, but instructed not to come out, by all of the health professionals.
It looked like we got back.
I've been staying in.
Alana, were you able to talk now?
Yes, can you hear me?
Yes.
Can you hear me? Okay, I had technical problems. So we also started July 6th with Congregate Meals, so to speak. We planned for 50 people. We had maybe the first day 30 something and the next day 40. So that's increasing. Our social service is doing it by appointments. All staff is here. Activities have not started yet, and we are planning to start soon. We're going to start bingo next week. The issue for us is we have a couple of our consultants are not vaccinated. And that's an issue for us. I know this is an issue for
who's not
everybody.
vaccinated? Who's not vaccinated? I didn't hear that.
I'm sorry, are not that the consultants, some of the consultants. All staff are vaccinated. We did require that, whether right or wrong, we did. And I'm very conflicted about consultants who are not vaccinated. I feel very strongly that people have a right to know that the consultant is not vaccinated. Now, I think there'll be lawsuits about all this, not necessarily for me, but I think these are going to be issues for everybody. So the two consultants that are not vaccinated were very open about not being vaccinated. They agreed that we tell the people in the class that they're not vaccinated and they are welcome to join the class or not. If we don't have then enough people to join the class, we will terminate that consultant. I don't feel, I just can't do it without telling people. I would be so infuriated if I was in the class and you were not vaccinated and you didn't tell me. As the teacher, clients, we can't ask if you're vaccinated or not, but that's where we are. So we're going to see. There are a couple of people who don't want to join the class without a vaccinated consultant. So we're going to see what our numbers look like. We have a consultant, a Zumba consultant, who had her first vaccination 2 weeks ago. So we're waiting for her to have the second, and then she will start. And our literature class is starting. He was vaccinated. It's a tough time. It is. Some of our clients are not vaccinated, and it's uncomfortable for people to be here. So anyway, we're all in the same boat, and we'll see how it goes.
Are you doing grab and go, Alana, or just
We're not. It's Congregate. And we have 3 people. Oh, something that was interesting. We do have people coming in to play dominoes. Now, somebody told me yesterday they're not allowing dominoes because it's not socially distanced. Well, we are. People are wearing masks, and they're doing it.
So I'm not allowing. I can tell you, I'm not allowing it. They have to sit too close. It's like bridge.
It's also a high touch activity. They're sharing pieces.
Yeah,
but again,
I'm not allowing it.
But so you're not. But it's an interesting thing that you're not allowing that, which I certainly understand. But you will allow a consultant who's not vaccinated not to tell people that they're vaccinated.
Everyone has to wear a mask.
Well, they're wearing a mask when they're, all right, let me, I don't know.
I feel like if I don't have to ask the clients, I don't have to ask the consultants, but I don't let anybody be in this space without a mask, and everybody has to do the COVID questionnaire, and everybody has to get their temperature checked.
So it's very interesting.
Our consultants are probably going to get tested once a week, the ones who aren't opting to get the vaccination.
So thanks to Mary, I was made aware of a meeting last week or 2 weeks ago, I believe. Mary, you can probably help me out. Gail Brewer's office, 2 weeks ago, I think, about the addressing some of the legal issues and the legal questions we're faced with.
Mm-hmm.
I left that meeting wondering if there wasn't more that we actually are legally allowed to do and allowed to say and allowed to ask. And I was really hoping that recording would get to DFTA and we would get some more guidance from DFTA or maybe some leniencies from DFTA, because it's not so clear, according to this lawyer that they had, that asking or people at least to self-select and to limiting, like they're doing in Madison Square Garden, vaccinated versus unvaccinated.
Right.
I don't throw around the word segregating, but from a legal standpoint, it's not segregation. As long as the vaccine is available to everyone and people are making a choice not to get it, she seems to feel that legally we were allowed to do different things. And I would really like to find a way to encourage DFTA to allow that as well.
But if DIFTA
Yeah,
is not
definitely.
allowing it, but
But based on what is DIFTA not allowing it?
I think
If
they're
it's
just
not
making
legally an issue,
right,
then then why are they doing it?
Yeah.
That becomes the question.
The explanation that I got is that we're under Matilda's law. And so what the
I'm sorry, could you repeat that? I didn't understand that.
That we are under Matilda's law.
Right.
And therefore the basic point of view that's being the guiding principles are going to be similar to what is being said is allowed or not allowed for assisted livings, for nursing homes, for adult daycare and the like. And it's a different population, it's a different situation, but it's not being treated that way.
But the governor never mentioned Matilda's law specifically with regard to senior centers.
But he also never
mentioned senior centers at all.
That's right. And he also has not alleviated any of the rules that govern nursing homes and et cetera.
But
And
we're not a nursing home.
And I understand that we're under that umbrella.
well, we're in uncharted territory, and we all got to just, I'm just doing what I feel is right for us here.
No, I appreciate that. I'm making decisions the same way.
Yeah.
Well, I haven't talked. I've been listening. One mistake I think
Carol, I just want to tell everybody a personal story, and I told Carol this yesterday, I think. My husband went for a colonoscopy last week, whatever, and they required all the patients to be vaccinated. And then the nurse asked him at the end, afterwards, said, make sure you get tested over the next 2 weeks, said you don't have COVID. And he said, why? I'm vaccinated, aren't you? And she says, I don't have to tell you. So he, of course, blew his stack at that point. But that's where we are. It's crazy.
Yeah. So. Well, looking back, I think I made a mistake because I started the grab and go on the day they told us we could start, and I started opening up on the 14th. Now, I told Svetlana that our lunch stops at 1:30. I'm working backwards now. We had, so far as the grab and go, it's been about, in the beginning it was about 20, and we had the limitation of only 27 people coming into the center. So the grab and go makes it possible to keep to that ratio. Let's say we serve 40 on a day, which has been pretty standard. A portion of them are grab and go, and the others are coming in. And the ones that are coming in are very happy to come in. I haven't heard them say anything. Now, moving right along, I wanted to mention Svetlana. I got in trouble with her because she would call me because the figures weren't in stars. So there was great hysteria in my office to get them in stars, which is not so easy if the meal stops for lunch at 1:30, but we've somehow mastered that. We have 3 thermometers, believe it or not, and they're all working. We take the temperature, and so far, knock wood, nobody has tested over the limit. They've all been under the limit. We screen them. If they come for breakfast, we try to not screen them for lunch. So maybe we've missed a few people, but I'm keeping track of the screening, and we're not recording the temperatures. Nobody mentioned that. I hope no one's recording it because from what I gathered, that's not legitimate. You can't really put down the records. Am I right on that, everybody? Nobody's recording the temperatures, right?
We're not recording here.
I think we're just saying yes or no. That's,
Yeah. Well, I show them.
Yeah.
I show them and they see it for themselves.
I mean, the
So,
only reason to do that is that if somebody does get sick, you're able to trace everybody else and track them.
yes. Oh, you
Right.
mean to remove them?
I
Well,
mean, the
believe
purpose
me,
of the purpose of this, as far as I understand, is that if somebody is sick, everybody who was there that day or whatever could be called and informed.
Right, but you don't need to record temperatures for that. You have your scans, you have your entry scans for the day of who was there at that meal.
Yes.
We're
So
not
that's-
taking temperatures because I have 3 brand new thermometers that nobody seems to know how they work. So
we
well,
are
they are a little,
not recording.
I think that they
Okay.
need rest in between. You take a temperature and then they have to rest a little bit, because if you try to take it, in other words, not used for a few minutes, because if you try to do it right after with the same thermometer, you don't get the reading. That's what I found. So, in other words, if you've used thermometer A, go to thermometer B and it works. If you've used thermometer C, in other words, you rotate the thermometers.
That makes sense.
Okay.
That seems to work. One is better than the other two.
Carol?
Yes.
I need to bring this section to a close because they're going to be stopping our recording. And I have a couple
I'll
other
just
things.
mention a little bit about the activities and then I'm finished.
Very briefly.
And also mentioning one thing, we don't have a problem with consultants because we're the consultants. I'm doing some of the things I did before, and I'm getting enough people to put it into stars. And we're also doing bingo. I want to mention that the domino people have accosted us on 2 separate occasions, and we told them, look, you can't play dominoes 6 feet apart. That is a requirement. So I will share with, I guess it was you, Fern, no dominoes.
No, it was
And
me yesterday. You're the one who told me, and we are doing dominoes. So now, I'm worried.
Well, this is what we told them, that they can't play 6 feet apart, so we can't have it in the center. Now, moving right along, the bingo is popular, always was. They're not caring. We go around, we give a mass every day, be sure they wear them, don't sit too close. We brought in more tables, et cetera, et cetera. I think they would risk, I don't want to even say it, but they're playing bingo. So I'm happy about that because they're playing. You just go day to day. Now, we have one problem. One of our staff is not going to be vaccinated. He's told everybody. I'm leaving that to my bosses. I'm not even going there. I don't tell him anything. They tell me, I tell him. That's the bottom line. But consultants aren't a problem. That's the end of my report.
Thank you.
Thanks, Carol.
All right. Thank you all for updating us.
Oh, and we're a cooling center. Nobody mentioned that. We're a cooling center.
Okay. How about you, Fern?
I'm not.
No?
I'm not either. We're just starting. So once we get into the swing of it, I guess. But our cooling center has never been very popular. Maybe we had 5 people in total in the past.
So I looked on the cooling center website, and it's Dykeman, Rain, and the Y in our neighborhood.
Wow.
Now, what are we doing what is everybody doing about the hurricane tomorrow? I guess
I'm having the guy's going to come in again and talk about it from emergency management. Powell.
Oh, yeah. Okay.
So we're having him too in August.
Okay.
I got to step out to lunch, everyone. Have a great day. Thank you.
Okay.
Goodbye.
Just want to update everyone on, some happenings. First of all, we have 6 new members of the community on the community board, Daniel being one of those people. So we, just want to say welcome to all of them. Couple of events that are happening on Saturday, the 17th, which is a week from Saturday. If anybody knows Coach Dave Crenshaw, down here in the neighborhood, he has the Uptown Dreamers. It's a group of youth who do a lot of good stuff for the community, and they're having an event on Saturday, the 17th, in the Haven Plaza, giving people help with their phones or devices. So if anybody that, you know, lives around the area and wants to stop by over there, it'll be throughout the morning. I think they're having like 3 sessions. So starting at 9:30. The other thing that's going to be coming up is that on August 2nd, and there'll be more information to follow, and I will send out flyers when they're available. It's National Night Out Against Crime, which every precinct in the city has an event, and it's not at night, it's really, you know, in the afternoon to early evening. So more information to follow about where the
interesting.
to be having those events.
Sounds like a good idea.
Yeah, that happens as a yearly thing. Obviously, it didn't happen last year, but it will be happening this year. You know, it's usually a fun event with a lot of information made available, performances, all kinds of things going on. And that's all I have. Does anybody else have any other announcements or ideas for future presentations or any of that?
Mag.
Okay, so I just want to wish everybody a happy summer, stay cool, stay well. And Maggie, thank you for
The
being
seniors
first.
just want to be
The first of the first to get your seniors involved in our meeting. So hopefully
They
we'll
said
resume
they
in
were so
September.
grateful.
Sorry?
They were so grateful. They said, thank you for including us.
Okay, and do me a favor. Do you have a rough number of how many of your people were on that?
Yeah, they
involved?
signed a list. 12.
12? Okay.
Okay.
Huh? 12. Okay, perfect. If you can email me that list.
Oh, sure, I can. You want me
Okay.
to type it up or you want a picture of the sign-in sheet?
Just the sign-in sheet, I think. Yeah.
Mary, it said at the bottom of the sheet that we would discuss what's going to happen in September. Have you any insight on that yet?
Not yet, no.
Whether.
So our next
Okay.
meeting will be September 2nd at the same time, 10:30. So we're going to keep it to the Thursday before Labor Day because of other things that are going on throughout the month and with the Jewish holidays and stuff. But we don't know. We've been told that all the meetings will be in person, but we're pushing really hard to have hybrid meetings so that people that have not been able to come to the center for the meeting, you know, to the center, the community board office for the meetings, can still be able to tune into the meetings, as well as the senior centers, you know, having their clients tune in. So
Mary, what day did you say it was?
September 2nd.
Oh, okay, okay.
First Thursday of September, okay? So I'll be, you know, along with the notice of the meeting, I'll be indicating whether it's going to be in person or hybrid or
Right.
what.
I'm sure. I just wondered if you had people talking what they preferred, you know.
Well, we all prefer, all of the committees have expressed interest in having hybrid meetings because the attendance at the meetings has
Makes
been
sense.
wildly
Makes
increased,
sense.
you know? Yeah. Because
Makes
people
sense.
are able to zoom into a meeting that they can't get to because of traveling and that sort of thing, or being away from the office or the center or wherever it is. You know, so, you know.
Were they saying they wanted that forever? I mean, they wanted that as a option?
Yeah.
Or
no,
they did? Yeah. Makes sense. Okay,
you know,
I wonder.
nothing's forever, but we'd like it forever, yeah. So see
Right.
you in September.
Ongoing, right?
Thank you.
Meeting
Thank
is
you.
adjourned at 12.
Have a great summer, everyone.
12.
You too.
PM.